Wake up in the morning, sun shining bright. Got my coffee brewing, everything feels right. But there's something special that I can't deny. Bougie, confident boss lady, she's the reason why. Serving wisdom fresh, like it's made to order. On the Shift Happen podcast, she takes across the border. From hustle to flow, her vibes never fade. She's dishing out the truth in an A-list parade. Shift happens, baby, don't you miss the beat.
Hello, my mighty shifters. Welcome back to another episode of Shift Happens. I am Corrina Jackson. I am your bougie, confident boss lady. I am your morning snack, your midday nibble, and also your evening unwind. This is Shift Happens, where real talk sparks real impact. Today we'll be diving into one of the hardest conversations I feel like we'll ever have, and that is why babies die in America. Why are babies dying in America? And what are we doing about it? So I want to talk about what we're doing in Tulsa to shift those numbers and save lives. This is an episode about truth, about heartbreak, but also about hope. So buckle up, mighty shifters, and let's get into it. Let's start with numbers, because behind every number is a baby, a family, and a future loss. And every year in the United States, around about 20,000 babies die before their first birthday. In some communities, those numbers are even worse. Black babies in America are more than twice as likely to die as white babies. And here in Oklahoma, right here in Tulsa, infant mortality rate are higher than the national average. So the question is, why? The reason babies die can be complicated, but we know the biggest culprit is preterm birth, low birth weight. Babies born too soon often struggle to survive. Birth defects. Some babies are born with health conditions that sadly they can't overcome. And sleep-related deaths. How many times have we heard that story? Unsafe sleep practices, like putting babies on their stomach or sleeping in adult beds, leading to tragedy. Infections, things like sepsis or pneumonia, can quickly become fatal for newborns. Maternal health issues, if a mom's health isn't good, health situations like high blood pressure, diabetes, stress, her baby's health is at risk too. Social factors, poverty, lack of access to health care, food insecurities, health instabilities, stress from daily life, especially from communities facing discrimination or historical trauma. It's not just about medical problems, it's about the environment we're bringing babies into. Now, let me just tell you this. These are not just statistics that I'm reading from a report. These are families that I've met, moms who did everything right, but still went home with empty arms. And let me tell you also that that's an effect on the father and the family as well. Dads who stare in the empty cribs because their babies pass away unexpectedly. Grandparents who grieve not just for a grandchild, but the dream that they had for that child's future. It's why I started Shift Happen, because these families deserve help. They deserve hope and answers. Here in Tulsa, Shift Happen is working every day to change those numbers. Our mission is simple, but it's powerful: to support healthy pregnancies, healthy babies, and healthy families. We have a wonderful program at Shift supporting healthy initiatives for Tulsa called Healthy Start. And it helps with some of these very things that I'll be talking about. We help with parents get into prenatal care early and consistently, learn safe sleep practices. We manage chronic conditions like high blood pressure or diabetes. We connect to mental health support, access to food, housing, and other resources, and feel supported through one's life's biggest journey. We believe every baby deserves a chance at life, no matter their zip code, income, or skin color. And guess what? It's working. Our programs have helped to reduce risk for hundreds of families right here in South Tulsa. The health department also has a Healthy Start that works with North Tulsa. Our programs have helped to reduce risk for hundreds of families right here in South Tulsa, and we're not stopping until every family and every baby has a fair chance at life. So why are babies dying in America? Because of medical risk. Yes, but also because of social, economic, and emotional challenges families face. It's not just about the medical problems, it's about the environment that we're bringing these babies in. But here's the good news, we have power to shift those outcomes. If you're listening today and you're a parent, a grandparent, a friend, a neighbor, you can help. And here's how you can help. Learn and share safe sleep practices, support families in your community, and advocate for better health care access. Donate or volunteer with organizations like Shift Happens. And I am going to push this effort a little bit further by bringing on some of the clients that we serve in our program, Shift Healthy Start, because I think it's important for you to hear the impact that this program has made on those clients. I got a chance to listen in on some focus group, but I also got a chance to form my own focus group to hear the impact that Shift has made with these clients. And before it was Shift, we were in another organization, but Healthy Start has been around for over 30 years now in Tulsa, Oklahoma. And to hear some of those stories and to hear those clients, the parents, those moms and dads, and to see some of the tears roll down their face of what would I have done if, my care coordinator or my navigator or my fatherhood coordinator would not have been there for me. And it's so important to listen to those stories and to hear those conversations, because those are the type of stories that we like to take back to our funding source. But like I said, to sit and listen to and hear the stories of those parents are powerful. It makes this business worthwhile. It makes every day easy to get up and go to a job and say that I'm truly making a difference in someone's life. We try to keep moms into care consistently to keep those babies out of the NICU unit. We also give moms things that they can do to make sure that they have healthy outcomes, but to listen to their stories and listen to their stressors and their complications is just as equally important in saving a baby's life as well. And so we do that, and you can too. So I'm going to challenge each and every one of you that are listening to this podcast today to reach out to your legislators and to keep programs like Healthy Start in place, because that's so important. They have the power to push these programs and to make sure that they receive the proper funding, to make sure these parents get the type of help that they need. Just to sit back and assume that there are programs that will address these type of issues is not true. It's a myth. If programs like Healthy Start don't stay in place, then no, you won't have programs that truly address the proper care that these parents need to make sure that their babies have a healthy outcome. And every baby deserves that chance at life. These are lives that we're talking about. I did a AP Press article and video not too long ago with a care coordinator. She's now a manager at Shift. And it was so refreshing. Two moms that actually did that video with us talked about Healthy Start and the impact that Healthy Start made on their lives, and just kind of the steps that we took to make sure that this baby was born healthy, and relieving their stressors that reduces complications, making sure that they have the proper housing, making sure that their bills are paid, making sure that they have food resources. All of those things are a plus. It goes back to the Maslow hierarchy, and I like to refer to that a lot when I'm doing my presentations, but it talks about the defined needs, and that if you don't meet the defined needs, you you can't even get to the tip of the iceberg of what you're trying to do. And so that's why it's so important that we at Healthy Start develop bonds with our clients. Relationships are key, they're a must, and they're a plus to talk things through. And just to be a listening ear for those clients. They need someone to talk to. You need to be able to put a care plan in place for them. And you can't do that unless you are truly, truly allowing those families to know that you're walking along beside them, that you're really listening to them. I also would call your attention to a documentary called Aftershock. It's put together by Tanya Lewis Lee, who is the wife of Spike Lee, a well-known creator of movies and short stories and things of that nature. You very seldom hear about the work of Tanya Lewis Lee, and I met her years ago at a conference. I want to say that it was an AMCHIP conference, and it's an American Maternal Child Health conference, and she was working on the minority health side, and she's been in the work for a long time, but she put a documentary together called Aftershock, and that's phenomenal. It's a 90-minute documentary. Tulsa, Oklahoma is featured in that documentary, as well as New York and some other states. But she talks to 3 fathers who have lost their significant other ones to what we call maternal mortality, and that was giving birth to their babies. The babies survived, but their moms didn't. And that's just kind of getting the attention of the provider and listening and making sure those providers are listening to you when you're going through your pregnancy. That is so important in your journey of your pregnancy. But anyway, if you have time to do so, I would love for you to look at that documentary if you can, because it is so powerful. But that's all I have for you today. I am so glad that you tuned in with me. And like I said, this is Shift Happen. This is a tough topic, but I believe in facing hard truth. That's the only way that we can change it. So if you want to support our work, or if you're a parent who needs help, visit our website, which is Shift-Tulsa. You'll learn more about Healthy Start there. And follow up on our social media for updates and resources and real stories for our community. There is so much out there, but if you're not aware of it, you won't know that it exists. So again, remember, this is Shift Happen, and together we can shift the future for our babies one step at a time. This is the meat that matters. I am Corrina, your host for today. I am so glad that you were able to tune in to this episode. And remember, let's take care of each other, because together we're shifting the atmosphere one step at a time. Until next time, I say goodbye for now.